Ahead and get started. Joining us today is Dr. Andrew Pavia. He is the chief of the Division of Pediatric Infectious Diseases at University of Utah Health and director of hospital epidemiology at Intermountain Primary Children's Hospital. And he'll give us an update today on how the COVID surge in Utah is affecting children, especially in light of schools starting across the state. Dr. Pavia.
So thanks everyone for joining. I've talked to many of you before, but I think it's really important today that we talk about what's happening with COVID-19 among children around the country and in Utah, and in the additional impact of other viruses that are being transmitted like RSV. There's a lot of misunderstanding as well as misinformation out there about COVID in children. And even if we look at the older data before Delta, children do get sick with COVID. It's one of the great bits of news that they are less likely to get severely ill than adults and that many will be fine, but that doesn't translate into kids not being affected by COVID. Not only can they get very, very sick, and we deal with that at Primary Children's frequently, but there are other impacts on children, including what happens when they're quarantined, if they develop long COVID, if their parents are ill. Now, when we think about the impact that we saw on children last year, you need to keep in mind that that was with a very different virus that was circulating, and it was with universal mask use in our schools that was strictly enforced. So the numbers from last year are probably an absolute minimum. The Delta variant has been an enormous game changer for children. It has led to really high numbers of children being diagnosed around the country. It's twice as transmissible. And because of that, it's leading to enormous numbers of cases in children, and a certain percentage of those get very sick and are hospitalized. Nationally, last week, there were 94,000 new diagnoses of COVID-19 in children around the United States, and there were 16,000 children hospitalized last week. That is the greatest number of children hospitalized in the United States at any point in the pandemic. That gives you an idea how Delta has really changed what we're dealing with. And children's hospitals around the country are reporting high numbers of children. And in parts of the country that are particularly hard hit, that have low vaccination rates and high COVID rates, they're seeing absolute record numbers of children in their hospitals and in their ICUs. Children's hospitals in Texas, Arkansas, Florida, Georgia, Missouri, are all reporting that they're breaking records and they're stretched to the breaking point. Now, here in Utah, we've seen a very large increase in the number of children being diagnosed. If you look at this week, which is before school started, and compare it to last year at this time, we're at about 2.5 times more children being diagnosed with COVID than we saw last year. And what's different than last year is that we're seeing a lot of these infections in kids in the 5 to 12-year-old age group rather than among the older kids in high school. This is all before school starts. Last year when school started, we saw an enormous surge of transmission, first in the universities and then in the schools. So the numbers that we're seeing now are just before things could get bad. The good news is that the numbers who are hospitalized in Utah have not risen to as great a degree as what we've seen in other parts of the country. We currently have 2 critically ill children in the ICU, a few others in the hospital, but we're not overrun by COVID. But we are experiencing a really severe crunch on pediatric beds in Utah. And that's due to many factors. It's not COVID exclusively. The most important thing perhaps is that because of flood damage and construction, Primary Children's is down by about 20% of our bed capacity. But there's also a surge in RSV admissions. It's summertime, kids are having serious trauma. And then there's the usual stress of caring for the sickest kids in the entire 4-state region that we serve. So Primary Children's is currently essentially has no available beds. We are into our surge capacity, which means we are using single rooms for 2 children, and we are using a number of other methods that we are very good at to stretch our capacity. But we're essentially at 100%. We're keeping kids in hospitals closer to home when we can, and trying to get them out early, but we really are stressed without a major surge in COVID. So what's going to happen when school opens? A lot of that really depends on what we do in schools. Last year, with universal masking, in-person school did lead to some transmission, but was relatively safe. We can have in-person school without huge surges if we have universal masking and combine that with distancing to the degree that we can, combine that with better ventilation, keeping sick kids home, and all the things that we know work. What we do know is that masks work best if everyone wears them. They don't work terribly well for the person who is wearing a mask if everyone around them is shedding virus. We do know that school can be safe in person, but it can't be safe if we don't have universal masking. We have studies from many parts of the world and parts of the US where masking wasn't enforced, where transmission in classrooms happened. That leads to transmission in the family, and that leads to transmission in the community. The other thing I really want people to be aware of is that not all kids are healthy and as able to fight off the effects of COVID as others. Depending on how you estimate it, up to a fifth of children in school have a medical condition that might put them at increased risk. It may be asthma, it may be diabetes, it may be obesity, or it may be something much more serious like cancer or a transplant. Those kids can only be protected adequately if everyone is wearing a mask. Many of the kids who are otherwise healthy have people at home, whether it's parents or grandparents, for whom vaccines don't work terribly well because they have cancer or they're on immunosuppressive drugs. And if they bring the virus home, they may cause very serious illness in members of their family. So I'm trying to be very dispassionate about this. I usually try and keep emotion out of these briefings. It's very hard for me. I feel very, very strongly that we are about to put our children at great risk. I heard one of my colleagues at the University of Alabama, who's a virology expert and has an equivalent position to mine, who is very dispassionate talking about this. And he almost broke down in tears. This is really very, very important to everyone who cares about children, particularly us as pediatricians who care for them. So I'm going to stop there and turn it over to questions.
Thank you, Dr. Pavia. One of the common questions is we're allowing reporters here with us today to add their questions to the chat. One of the common questions that we often hear is about COVID and flu comparisons, and questions as about if children weren't masking during flu, why is it important for them to mask now?
It's a great question. So flu is not nearly as transmissible as SARS-CoV. Flu has what we call a reproductive rate of about 1.8, meaning you infect about, on average, one person when you are, or 1.8 when you're infected. And the current Delta variant is estimated to be 5 times higher. This is one of the most transmissible viruses we've dealt with. And even though we thought at the beginning that flu posed a greater risk to kids, Delta is more serious among children. And in the first year, with strains that were not affecting kids nearly as much, we had almost twice as many pediatric deaths in children, as we would in our worst flu year. So this is much more serious. The other thing is that we have a pretty effective vaccine. It's not great, but it's an effective vaccine for flu. For everyone under 12, we don't have a vaccine to offer them.
Thank you, Dr. Pavia. We have a question from Kelly Vaughn, at KUTV. She says, some parents say that wearing masks in school is harmful to the children's health and mental well-being. What would you say to these parents?
I'm afraid that's a myth. Kids don't always like wearing masks, and it can be hot, it can be annoying, but the American Academy of Pediatrics, which is the largest group, it's the group that represents all the pediatricians in the United States, has carefully reviewed the science, the issues that people bring up. there are no major risks to children by wearing masks. They don't retain CO2, they don't not get enough oxygen, they don't suffer serious language delay. They, there may be the occasional headache that we have to concede to. For kids who have language delays, there are some issues that we need to think about, but there the issue is not to put themselves and everyone else at risk by not wearing a mask, but to work with a speech therapist. And speech therapists will work with a transparent mask so they can see their mouth and work on things. There is no serious risk to wearing a mask, and there are very, very serious risks to allowing COVID to spread unchecked in our schools.
Thank you, Dr. Pavia. This is one from Dan Baumus, KSL News Radio. If the schools don't require universal masking this school year, would you recommend parents keep their children home for the start of school?
That's a very difficult question. And I don't have a single answer. Every parent's got to think that through for themselves. I really hope that we will do the right thing in our schools in areas where there's lots of transmission and parents don't have to make that very difficult choice. And I hope our political leaders will follow the lead of our scientific experts like Dr. Dunn and do the right thing. That said, I think the factors to take into account when you're dealing with that decision is your child at increased risk because of lung disease, heart disease, cancer? Are people in your family at increased risk and can't be protected by vaccine? How well did distance learning work last year for your child? Some kids thrived, others had a great deal of difficulty. In-person schooling is generally better for most kids, but some kids do pretty well with learning at home. Those are the kinds of factors you have to think about.
Dr. Pavia, we're getting a couple of questions regarding the Salt Lake County Council. And you partially addressed that just a moment ago, but more directly, what would you say, this is from Rick Aaron, what would you say to the Salt Lake County Council members who may vote or who are about to vote to overturn Dr. Dunn's mask mandate for K-6 students?
I think it would be a terrible mistake. I think they don't understand the risk to children. They may not understand the science behind mask use. I think the important principle here is that we really want to follow the science and leave scientific decisions in the hands of people who have our kids' best interests at heart and who are not subject to the political winds that affect politicians. I think it's absolutely essential that they follow Dr. Dunn's recommendation and allow mask use in schools, at least until we have this surge under control.
Thank you, Dr. Pavia.
Let me add one more thing, and I may get in trouble for saying this. I think, as doctors and public health officials, we take responsibility for trying to protect the health of kids. And I think if people overturn those recommendations and kids get very sick or kids die, they have to realize that it really is their responsibility now. They should think very long and hard about that.
Next question from Jed Bull with KSL TV. With the hospital already full, what happens if there is a surge among children?
Well, we in healthcare are very good at finding ways, but it is going to be very difficult. We're going to have to cancel elective surgeries. We're going to have to place children in places where we're not used to providing pediatric care. We are going to put 2 and 3 kids into rooms that are designed for 1. We're going to work double shifts and mandatory overtime. We'll get it done, but I think it's incredibly frustrating that the public expects us to just keep finding more resilience somewhere. Every ICU doctor I know is burned out. Every ICU nurse I know is at the end of his or her rope. And that's true in children's hospitals as well as in adult hospitals. We really need people to help us out here.
Dr. Padilla, could you give us an update or maybe the latest information that you have on when to expect a vaccine to be available to children under the age of 12?
Unfortunately, things haven't really changed very much there. Right now, we expect from what Pfizer and Moderna have projected that they'll have data to submit to the FDA possibly in September. However, the FDA has asked for additional safety data, and we're not sure if that will delay getting all that data to the FDA. Now, we fully want FDA to take some time reviewing that data really carefully, being absolutely certain that vaccine is safe and effective in that younger age group, 6 to 11. So I don't expect that they'll be able to come up with an answer right away. Best guess, November to December, but it's a guess.
Thank you. We have a question from Alfredo. He says, last year flu cases dropped dramatically, and now we're at risk to get it since there's not a mandate for masks, or should there not be a mandate for mask or universal masking? Do you think that that will make the crisis worse? And explain, if you would, please.
It's very hard to predict flu, but I think the odds are very high that it will make things worse. Last year, we had no flu. We had no RSV, essentially. Most of the other respiratory viruses were gone. Those of you who have kids probably never saw a cold all winter. This summer, without mask use, we're already seeing other viruses come back, particularly RSV. And that's really striking. It's kind of shocking because RSV is a winter virus. It never appears in large numbers in the summer, and yet we're having a big surge of RSV. We're also seeing other viruses like parainfluenza, some of the other coronaviruses. So if we continue on the same path we're continuing on, I think we are going to see these other viruses, and there's a very good chance that we'll see a significant amount of flu. We have already anecdotally seen kids who are infected with RSV or parainfluenza who get COVID get quite a bit sicker than we would have expected from COVID alone. So we're very worried about the effect of having two viruses on the individual child because they might get sicker, and on the overall ability for us to respond and take care of them.
Question, Dr. Pavia, what do you, what is the information that you have or the beliefs in the medical community as to why the Delta variant seems to be affecting children more?
That's a great question. At this point, what we know is that it's much more transmissible, almost 2 times more transmissible than the viruses that we had last winter. And I think that is overcoming any decreased risk children had of being around infected people. What we're not sure of is whether this virus is by itself more severe in children or whether it's just infecting 2 to 3 times more children, and therefore we're seeing 2 to 3 times more hospitalizations and serious disease. Many of my colleagues that are seeing a lot more of this around the country have a strong gut feel that it is worse in kids. They're getting sicker faster. More healthy, previously healthy kids are getting into a lot of trouble, whereas before it tended to be the kids with underlying conditions. But we don't really have rock solid scientific data to prove that. And until we really have that, I want to say that it appears to be worse for kids, but we're not absolutely certain. Worse in that the virus makes them sicker. It is absolutely clear that it infects a lot more kids.
Thank you, Dr. Pavia. And we have one from Jenny Rollins at KSL.com. Many parents seem concerned that even with a mask mandate, children under the age of 12 will not be vigilant about masking, pulling it off or forgetting, for example. How would you respond to this from a scientific perspective?
Well, this is an example of having to look at the pragmatic science. So last year, when kids were required to wear masks, they weren't perfect. They scratched their nose, they would fool around. Teachers had to remind them. But when we looked carefully at transmission in classrooms, in those classrooms where mask use was universal and it was being enforced, transmission went down dramatically. So it would be better if kids used them perfectly. It would be better if they used them when they weren't in the classroom as well, when they were on the school bunch or bus or over at their friend's house. But even with the use that we see in real life, it works pretty well. Now, that said, I'm amazed at how well kids are learning to wear masks. I see kids coming in my clinic as young as 4 or 5 who keep their mask on the entire time and do it well. And so I think it's just a matter of teaching kids and expecting them to do their best, and they do.
We have a question from Aaron with the Salt Lake Tribune. Is there anything about pediatric COVID care that is more specialized than adult COVID care that makes staffing less transferable? And last year, hospitals shifted doctors and nurses from elective procedures to ER and ICU care to take on surges. Could that be done for pediatric emergency and ICUs?
Let me answer the last question first, Aaron. We definitely have contingency plans that includes delaying elective surgery or stopping elective surgery and using those nurses and doctors to help increase our capacity. Taking care of children is something that is different than taking care of adults. And it is much better to have nurses and doctors who are fully trained in taking care of kids. But, for those who are less sick, we can use all the help we can get. There are things that we do at Primary Children's which are incredibly specialized, which can't be done by people who don't have that pediatric subspecialty training, such as keeping a child on a very small child on a ventilator, or putting them on a heart-lung bypass on ECMO. And that capacity is strictly limited to what we can provide in the top flight children's hospitals. As you know, we are the children's hospitals for a 4-state region in the Intermountain West, covering an enormous area. And our colleagues in Denver and Seattle and San Francisco and LA, who have similar capacities, are also being stressed and pushed to the max. So we can't just ship kids elsewhere.
Another question from Aaron with the Tribune as a follow-up. The state is providing some supply of KN95 masks to schools for kids for use. Is that a good solution to better protect masked kids from unmasked kids, and why or why not?
So better masks are more effective than less effective masks. So KN95 masks are certainly better than a poorly fitted cloth mask, and a well-fitted cloth mask is better than a poorly fitted one, and a surgical mask is better than a cloth mask. But no mask is likely to provide 100% protection if you're exposed to large amounts of virus, particularly with this hypertransmissible strain of virus that we're seeing. The other thing that we're just uncertain about is KN95 masks are designed in adult sizes, and fit is essential for any of these high efficiency filtering masks. We're not sure that KN95 masks are going to fit children well enough to have the same degree of efficacy they do in adults. That said, I think it's a great step. I don't think it's enough. I think everyone needs to be masked.
And we have a follow-up question from Jenny Rollins. How do you believe this upsurge will affect daycare centers and childcare for people returning to work?
We're seeing that right now among my partners. We've got people who are out because their children are affected by a daycare outbreak. The same things apply generally in daycare. With good masking and having kids being protected when they're in daycare and out of daycare, we can keep those numbers very low. However, one of the things that we're really worried about is that if kids are sent home from school because they're sick or because they've been exposed, that means that there's a parent who has to stay home. That's going to have an impact on whatever business that parent works for. It's going to have an impact on the economy. And if that parent is a nurse, a respiratory therapist, or a doctor, that has an impact on our ability to deal with the surge and care for sick patients.